Are you suffering with stubborn sciatica issues that just won't go away? Maybe you've tried injections, pain medication, rest, ice, physical therapy, but you continue to have some symptoms and you're just not sure what to do next. So this was a question that was asked on my YouTube channel, and I decided to make this video because there's one particular thing that needs to be addressed if the tissue has already healed, but you're continuing to have sciatica symptoms. Now, first, we're going to talk about 3 things that we need to make sure are true before you try these exercises. Now, first, we need to cover 3 key points to make sure that you qualify for these particular stretches and exercises that we're going to talk about, because they are not for everybody. They are for people who have already done physical therapy, injections, all of that stuff, but they can't seem to get those sciatica symptoms to go away. So what are the 3 things that we need to look at? First thing is we need to make sure that the tissue has healed. Now you may say, well, sciatica, it's the sciatic nerve, that's the tissue that's damaged. Yes, I understand the sciatic nerve is the tissue that's damaged, and if you're still having symptoms in the sciatic nerve, then obviously you wouldn't be watching this video right now. However, what is the structure that put the tension on the sciatic nerve in the first place? Was it a disc? Was it the piriformis? Was it something else? You need to make sure that that tissue has healed, because if not, then what we're going to do next is actually going to aggravate things even more. So that wouldn't be appropriate for you. Now, if you're not sure if your tissues have healed yet, I'm going to link some videos here so you can go watch those and learn more about your sciatica symptoms. Now, number 2, another way to know if your sciatica symptoms have healed and are stable enough for what we're about to do is, are you still having sharp shooting pain? If you are, then I would say either the nerve has not healed or the original injury that caused that nerve pain has not healed, because you're still having that sharp shooting, lightning-like pain that runs down the back of your leg. So if you are still having that, then these stretches and exercises are not going to be for you. Go check out those other videos. The third thing that I need to know, and you need to know before you try these stretches and exercises, are you moving correctly? It is very important to know that your body in general is moving correctly. There may be some stiffness or tightness or tension or something like that, but you're not doing any wonky movements. Now, the best test for that is, how do you do a sit to stand? So if you are sitting down in a chair or standing up from a chair, do you find that you're still having to compensate? Are you having to use your hands? Do you feel like you're kind of twisting to get up? Are you doing some kind of abnormal movement in order to be able to get into that position? If so, these exercises and stretches are not for you. What I need you to do instead is watch these other videos and get your symptoms to calm down so that you have normal movement, no sharp shooting pain, and your initial injury is healed. All right, if you're still with me at this point, then that means you qualify. So I'm going to give you some very, very simple things that you can do that will help to relieve that sciatic nerve. Let me explain what's going on. Your tissue has healed. Your sciatic nerve is stuck. That's what's happening. It's stuck down in the fascia, probably, maybe in the muscles, and it just is causing that dull, achy, I feel like I can't get back to things type movement. So you can call these stretches and exercises, you can call them, neural flossing, you can call them fascial stretching. Frankly, I don't care what you want to call them. What they're going to do is to release that tension on the sciatic nerve. Now, it's very important that as you do them, you may feel tension, you may feel a little bit of achy, but as you do them more, the pain has got to decrease. If you do these exercises and you feel like your pain is increasing, then it's not your time to do these yet, okay? And with sciatica, I am very, very careful, because you know what it's like when it gets flared up. We don't want to flare it up. That is not the goal. I hope I put enough cautions in the way, and let's get to the stretches. All right, we're going to start with the gentler of the 2 stretches and exercises. What I'm going to have you do is prop your foot up on like a stool, maybe on a step. It can be something, it doesn't have to be super high. So you're going to prop your foot up, And then I'm going to have you bend forward, but you're going to be hinging through the hips. Now, this will help to decrease the stress on the low back. You're going to hinge through those hips and bend forward as far as you feel comfortable with. You should feel that hamstring stretch. That's normal, and that fascial stretch in the back. Now, you should not feel like your sciatic nerve is getting really, really tight, and definitely no sharp shooting pain. But what you're going to do is just move through this motion. So you're going to go forward and back, and that should help decrease that tension on that sciatic nerve. After you're done, you should feel a relief of your symptoms and definitely not an increase. Again, if it's increased, then this is too aggressive of an exercise for right now. Now, if that stretch was good, this one is going to feel amazing. But again, you need to make sure that it's not increasing your sciatica symptoms while you're doing it. So here's what you're going to do. You're going to do a forward bend. I know. You're like, I don't know if I can do that. We're going to do it very, very carefully, okay? Very specifically. So you're going to start standing up nice and tall, equal weight through both legs, and then you're going to roll down. So you're going to tuck your chin down to your chest. Your shoulders are going to roll forward, rolling all the way through that spine and going down as far as you can to really get that stretch through that back line. And then you're going to roll back up. Same thing. You're going to put your spine on top of your hips, your shoulders on top of your spine, and your head on top. Rolling down, and watch how my back is really, really arching. We want to make sure that we get that nice roll through and that you're not hinging from the hips on this one. Last one, we hinge through the hips. This one, we're rolling through the spine. I usually have people do that about 5 to 10 times, and they start to feel like things are moving a little bit better. Now, if these stretches don't work for you, or you don't know the root cause of your sciatica symptoms, then I highly recommend you find a manual physical therapist who can help you get to the root of this problem to get rid of it for good. If you have sciatica questions, the other thing I'd recommend is my book, Movement is Life, and we'll drop a link to that below.